excellent material to cover today, so I think we're going to dive into it. We've got a great lineup of speakers, and they'll be sharing their expertise and experience with us about mental health strategies in the workplace. And so I'd like to thank Darcy Grudadaro, Jennifer Brunner, and Janelle Penitzer for joining us today. Darcy is the Director for the Center for Workplace Mental Health at the American Psychiatric Association Foundation. Jennifer Bruno is the Vice President of Global Health Services at Johnson & Johnson. And Janelle Penitzer is the Wellness Program Manager at OrthoCarolina, and they'll be telling you more about their organizations during their presentations. But before we dive into the presentation, I just have a few housekeeping notes for everybody to bear in mind. This webinar is being recorded for later distribution. We have almost 200 companies that are already on the call and rising, so there's obviously a lot of interest in this topic, which is terrific. If you have a question that you would like answered, please submit it using the Q&A function within WebEx. When submitting the question, please ensure that it's addressed to everyone and not just a specific presenter in the webinar. We will do our best to answer the questions at the end of the presentations. We will be having polling questions throughout this webinar, so to participate in these polls, please submit your answers through the side panel on the right-hand side of your screen when the questions show up. So as I said, we have quite a lot of material to cover, so without any further ado, let's start off with the first poll. So the first poll question is, does your organization have and actively promote a written mental health policy? And so you can answer yes, no, or I don't know. And so I'll share with you, a few minutes ago, we had this discussion amongst the panelists, and I would say that it's fair to say that we are at different stages of developing and implementing our own mental health policies in our organization. So there's absolutely no shame in saying no or I don't know. So we'll just give the poll a few more seconds so that people can answer it. So Kristen, do you want to share the results with us of this poll? Kristen, can you hear us?
Yes, it is loading. It will share in 3 seconds.
Thanks so much. Right. So this is putting my statistics to the test because I'm seeing raw numbers, but it looks like for the majority of people on the call, it's either a no or I don't know, which I think is very insightful. There are 19 of the 179 companies currently on the line who already have a written mental health policy in place, so congratulations to you. Hopefully by the end of this webinar today, you will have more information and more ideas about how to take the discussion about having a written mental health policy in place in your own organization. And that's something that we at the center here at AHA have been doing with our own HR, so it's part of that process. So thank you very much for participating. So before we get to our first speaker, you might be wondering, why is the American Heart Association addressing mental health? And it's for 2 reasons. The first reason is we have a new mission statement, which you see on your screen there, which is we are a relentless force for a world of longer, healthier lives. And so what you might notice in that mission statement is that it doesn't have the word heart disease or stroke. All of our activities here at AHA are grounded in heart health and brain health, but we're now really looking at the person more holistically, and we recognize that mental health is a crucial part of one's overall health and well-being. So I will be saying a few words towards the end of this webinar, but without further ado, I'd like to turn it over to Darcy for her slides. Darcy?
Yes, thank you so much, Chris, and I'm really happy to be here. I did want to just say a word about the Center for Workplace Mental Health. We are a program of the American Psychiatric Association Foundation, which is the philanthropic and programmatic arm of the American Psychiatric Association. We at the Center for Workplace Mental Health work with employers of all sizes, large, mid-sized, and small, providing them with tools, resources, and information they need to promote and support the mental health and well-being of their employees and their families. So we're delighted to be here. We are very pleased to be joining Chris, his team, and the excellent work that is being done at the American Heart Association on workplace mental health. Very impressed with the recently published report, Mental Health, a Workforce Crisis, and honored to be here during Mental Illness Awareness Week with this very impressive panel of speakers. So next slide, please. I think it's safe to say, oh, poll question. I'll let you take that, Chris, before I jump in.
Great. Thanks, Darcy. Yes, we had a poll early on in your slide. So our next poll is we just want to see whether people know what percentage of U.S. adults have been diagnosed with a mental health disorder. So you see a couple of options there, 5%, 10%, 15%, 20%, or 1 in 4, or 25%. So give us your best guess as to what the prevalence of mental health disorders in the U.S. population is. Okay, we've had about 204 people participate in the poll. There are a few more of you outstanding that you may want to give us an answer to those questions. Okay. So most of you think that it's 20% or 25% of the U.S. population. So with that result in mind, Darcy, why don't you tell us a little bit more about the prevalence of mental health disorders in the U.S.
Sure, happy to do that. This is clearly an astute crowd that is very close and on target, between 20 and 25%. There are actually 47 million Americans, 1 in 5 adults, who are living with mental health conditions. And I would say, as we're talking about workplace mental health, that workplace mental health is really having a moment because employers really see the impact that mental health conditions are having on the bottom line and in the workplace. But the key message here is that mental health conditions are common. So 47 million U.S. adults, or 1 in 5, live with a mental health condition. And the overwhelming majority of those adults living with mental health conditions are in the workplace. Also, the data shows that about 19.3 million Americans aged 18 and older also lives with a substance use disorder. So the total number of people that have either a mental health condition or a substance use disorder condition is at 57.8 million people. The impact of that is considerable. However, we need to remember that less than half of people that live with mental health conditions are receiving treatment. So that is a really important figure. That is from the National Institute of Mental Health. And it's concerning because without treatment and without early treatment, conditions can get difficult to treat and can be very difficult, not just for the individual experiencing it, but also for family members and caregivers, many of whom are also in the workplace. Also, we know that treatment works. So we really want to encourage, and the workplace is certainly a place to do that, people to feel comfortable accessing care when they need it and connecting with care through EAPs and or health benefits. But really, as many of you can no doubt appreciate, mental health conditions really impact all aspects of the workplace: recruitment, performance, productivity, disability rates, and retention. And it can be costly for employers if mental health is not actually addressed. So on to the next slide, please. I did want to show a breakdown of demographics. What's important here is to recognize that, as you can see on the slide, hopefully you can all read it well, younger age groups have a higher prevalence of mental health conditions. And this is likely to continue to be an issue because we know that there is a growing rate of mental health conditions in adolescence. It's actually a concerning and alarming rate, high rate, particularly with depression and anxiety. So the future workforce that's coming along will be experiencing mental health conditions at higher rates, and this is, of course, an important time for employers to be prepared and to focus greater attention on workplace mental health. But in that 18 to 25 age group, you can see that spike in mental health conditions and people who live with mental health conditions. And also noteworthy is that women tend to have, or actually have, a higher percentage of mental health conditions and live with a higher percentage of mental health conditions than men. And this is especially true when it comes to depression. Women have about twice the rate as men. And that's important because we know so many women are in all different levels of positions within organizations in the workplace. So it's important to also note that diversity matters as well. If you look at the far right on the slide, you see a big jump up with people that have two or more, that fit into two or more categories of race and ethnicity, have a considerably higher rate of mental health conditions in the U.S. So did want everyone to see that breakdown so you get a good, solid appreciation that not only are we seeing mental health conditions more prevalent in the younger age groups, but those individuals are coming into the workforce with the expectation that employers are ready to effectively address mental health in the workplace. So next slide, please. The other thing that's important is we now have good, solid research that shows mental health conditions are costly. So effectively addressing workplace mental health is not just the right thing to do, but not doing so is costly to employers domestically and globally. So we know that $1 trillion is the annual cost to the global economy in lost productivity for just depression and anxiety alone. And that figure comes from research that was released by the World Health Organization. In the U.S., the annual cost to the U.S. economy for depression is $210 billion. That breaks down as representing about half of that is lost productivity, and about a little under half of that is direct healthcare costs. There's a slight cost also associated with suicide and the impact that suicide can have on those within the workplace. On the lost productivity part of the $210 billion, that breaks down to represent absenteeism, people that because of depression are not coming to work, and also presenteeism, which is a real growing concern for employers because that represents people coming to work but not fully engaged and not performing at the level that they can perform at because of the impact of depression. The next line, 2 to 3 times higher treatment costs, that represents the fact that when employees have a chronic health condition and a co-occurring mental health condition, the cost of treating the underlying chronic health condition is 2 to 3 times higher. So it's not uncommon for people with chronic conditions like heart disease, cancer, diabetes, and related conditions to have an underlying mental health condition. However, treating that chronic health condition is considerably higher, making the need for employers to really pay attention to the cost of treating mental health conditions important and the ability of people to access mental health care, effective, timely, and affordable care, making it all the more important so employers are not incurring that extra cost associated with treating the underlying chronic health condition. And then finally, this is really important. In the U.S., so this is just in the U.S., every $1 invested in scaled-up mental health treatment results in a $4 return on investment in better health and productivity. And again, those are figures from the World Health Organization. That certainly also makes the case for really investing in mental health treatment and employers paying more attention to people's ability to get access to treatment. Next slide, please. So this is certainly a major call to action, and depression and anxiety are common conditions found in the workplace, and depression is the leading cause of disability worldwide, with rising rates impacting employers. So again, costs associated with depression when people leave the workforce for short-term and long-term disability. Clearly there are costs associated with replacement and also losing valuable employees who are performing well in the job. Rates of anxiety and depression, as I mentioned earlier, are growing in youth and young adults. So that is the future workforce in the U.S., and it really is something more and more employers are paying attention to because they know that the future of their organization depends on hiring well-qualified, high performers into their workplace. And then finally, just a word on suicide and opioid. Both deaths associated with suicide and opioid are at historically high levels, and that is impacting businesses across the U.S. When you think about the fact that the latest figures we have are 47,000 lives lost to suicide in 1 year and 72 lives lost to opioid deaths in 1 year. When you take those numbers together and you consider the circle of people around those who are lost to these tragic deaths at a young age, and that circle of people includes many people who are active in the workforce and the impact it has in disruption on their productivity and on their attendance and just on their health and well-being, you really gain a great appreciation for the fact that these kinds of tragic deaths are an issue that employers are increasingly growing concerned about and want to do more to be able to effectively address. So the bottom line, addressing workplace mental health is not just a moral imperative, but also a growing economic imperative. And I think that's why so many employers are so engaged in this work. So with that, I'll turn it back over to you, Chris.
Thank you, Darcy. That was a really helpful background about the state of the nation when it comes to mental health and also substance misuse. And it's worrying to see those trend amongst young workers because those are some serious productivity headwinds for employers because this is the workforce of the future. Do you think that employers are more concerned about this issue, and what are you hearing in your position?
I absolutely think employers are more concerned, and the National Business Group on Health and Willis Towers Watson and other national well-regarded consulting firms and membership organizations have done national surveys of employers that show workplace mental health and substance use are issues of major concern. Employers are really interested in helping understand how to help their employees navigate the mental health system, how to access effective and timely care, how to create a culture and climate that is more addresses more effectively mental health in the workplace, and also how to help raise awareness and address stigma, which remains a barrier to people feeling comfortable coming forward and getting help. People are worried that coming forward could result in negative job consequences. So that is something we all have to work hard at, helping people to understand that coming forward and getting help means you can get better and perform at your best and have your best opportunity to really have a bright future in the career that you're in.
Great, thanks very much. And you listed a couple of barriers and obstacles to mental health prevention, and we're now going to hear from two organizations who are, rolling up their sleeves and doing the work on the ground to create mental health friendly work sites and to help their employees with their mental health. And first off, I'm delighted that we have Jennifer Bruno with us, who's from Janssen & Janssen. Jennifer is also a member of the American Heart Association's CEO Roundtable. That is a group of, for now, 47 of the nation's largest employers who've come together to help create healthy companies and healthy communities. So welcome, Jennifer, and tell us a little bit more about what you're doing in mental health at Janssen & Janssen.
Great. Thank you so much, Chris. Really appreciate being part of this discussion today. And Darcy, thank you so much for setting us up with the rather sobering statistics going on right now across the U.S. and even globally. But let me just start with sharing a little bit about Janssen & Janssen. We are an organization that has 133-year history of caring for people. In fact, many of you probably know we are the largest and most diversified healthcare company in the world. We have roughly 130,000 employees, 260 operating companies in about 60 countries right now, and more than 1 billion people around the world use our products every day. We break down into 3 specific sectors. We have a pharmaceutical business, a medical device business, and a consumer business. And we've got a really strong focus and commitment to ongoing innovation. But what I really wanted to talk with you about today is our mission to profoundly change the trajectory of health for humanity, and our belief really that starts with a focus on our own workforce. So I think Chris asked a question a few moments ago, like, are employers worried about mental health in the workplace, and are they paying attention to it right now? And Darcy, I couldn't agree with you more. Like, it really is a perfect opportunity, because mental health really is one of the leading healthcare challenges of our time, and it is affecting all of us. And really, when I look at the workplace, I believe we're uniquely positioned to take the lead in addressing mental well-being challenges. Employees spend so much time at work and get so much of their information, get so much of their support and resources from work, that investing in mental health really does make good economic sense. You know, the numbers that I'm using here, while not exactly the same as Darcy shared, they do come from the World Economic Forum, and I'm looking at a $2.5 trillion a year cost of lost productivity, and that's combining beyond the anxiety and depression that Darcy shared. But also looking at a number referring from a key study from 2007 that says it does make sense to invest in prevention and early intervention for all aspects of mental health, because there is an opportunity for a $2 to $4 return for your investment. You know, our approach in J&J is really around promoting positive mental health while supporting employees who are facing mental health challenges or having someone in their lives who are facing mental health challenges. And our focus really aligns with the American Heart Association's 7 strategic pillars for supporting a mental health friendly workplace. Next slide, Chris. You know, as I mentioned before, you know, we are looking to change the trajectory for health for humanity, and starting with our employees is really important for us. We invest in our employees in a way to ensure the long-term commitment to their health and their resiliency. You know, our company, Johnson & Johnson, is guided by our Credo. And again, I keep using the word committed. We are committed to helping our employees and their families and the communities in which we work to have people live well across their whole lives, with a focus on mental, emotional, physical, and even financial well-being, because our goal is to enable an engaged, purpose-driven workforce that really improves health for humanity. So today at Johnson & Johnson, we are committed to employee mental well-being even more than ever before. We've started a coalition to help address mental health in the workplace. And as we look to 2020, we are committed to engaging and empowering our employees to achieve their personal best, pursuing programs and policies to support every individual's unique purpose and wellness. Next slide, Chris.
Thanks, Jennifer. That was really very, very helpful. So one of the questions as we launch into poll 3 that I'm just going to read out to the speakers for their reaction is, the question that came in was, is there any data on why young people are more depressed compared to other cohorts? Is there anything, Darcy, that you can, or Jennifer, that you can share from your, from what you know, from your own experiences?
I would say this is Darcy, and I would say there's been speculation and some preliminary research suggesting that social media may have, and this sort of feeling of always being on, you know, just constantly comparing yourself to others, and the level of intensity with work and work hours, and the fact that people have their devices with them and seem to be always connected to each other, to work. There's not as much downtime. There's a lot of speculation around how these variables may play into the mental health and well-being, especially around depression and anxiety, just not disengaging and letting your brain rest a bit. So I don't think there's a whole lot of conclusive data on this yet, but I think that the research is evolving.
Yeah, and I would add to what Darcy just said. I think the pressure on young people to succeed, the pressure to feel they need to be perfect and as good as everybody they see in social media, and to excel both in studies and sports and friends, and the challenges that young people are having with bullying. I think that all of those are adding into it. And I agree there's a lot of speculation and a strong focus on trying to understand even more so, which is why I think this makes it so challenging, that there's so much suffering going on and a need to really intervene early and fast.
Great. So the results from the poll, and sorry, I didn't read out the poll question. The poll question is, do your health and wellness benefits actively ensure parity between mental and physical health treatment? And 10% of you said no, and 5% of you said yes. So Darcy, I know that's one of the issues that you brought up during your slides about ensuring equitable access to mental health prevention and treatment tools. So back to you, Jennifer.
Thank you, Chris. You know, Johnson & Johnson has prioritized workplace mental health as an area of focus, and really looking to elevate it to the same level of importance, you know, if not even more so than physical health. And we're raising this awareness on the connection between mental health and physical health, because if employees are feeling stressed or struggling with mental well-being, we believe we have a responsibility in the workplace to support them and to provide the tools and resources for them to be their personal best, as I said earlier. You know, we're really looking at mental health and physical health are inextricably linked, and I think we saw some of that in the mission that Chris had shared of the American Heart Association. Now, there is such a connection there. You can't have physical health if you're not feeling mentally well, and vice versa. So at Johnson & Johnson, we're focusing on three key areas to address mental health and well-being. And we're looking at both the physical aspect, we're focusing on healthy eating and healthy movement, and we're also looking at healthy mind. And we have created policies to support all three of these areas. One of the things we're looking to do is champion personal health and well-being and making it part of the job, including it into the objectives and goals that our employees have so they can be their best both at work and at home. Next slide, please, Chris. If I share a little bit more about how we're tackling mental health, you know, especially when I look at World Mental Health Day coming up and the opportunity to really be able to carry the message around reducing stigma and creating the awareness of mental health issues globally. One of the areas that we're focusing on is a campaign across J&J right now that says #I'mHere. And it really is allowing people to know that they can talk about mental health, that they can bring the conversations up, that they can share their stories, and it's a safe place to do it at work. The other thing we're doing is really focusing on expanding our resources, and our policy outlines the expected approaches that we want to have in our workplace, and these including supportive programs that support workplace reviews and other online personal empowerment programs. And so we've got resources and apps that we are regularly piloting and trying with our employees. We get their feedback, things that they could use, whether it be at work or at home, and things that they can also use with our families. Another thing that we found out is that our people leaders are asking for training. They want to be a supportive leader to their employees. And we've done some mental health first aid training. We've done things to support our managers so that they're appropriately helping people come back to work after having a medical leave related to mental illness. And we host a wide range of webinars that we've found to be very valuable in our employee population because people can sit at their desk, They can do it during the day at work. We offer them in the evenings and in the morning so people can also listen in from home. Sometimes they're only 15 minutes on a topic related to mental health and well-being so that people can get some quick information and some quick action. We are definitely aligning and have been aligned with ensuring that we've got mental health programs through all of our medical benefits and really with a focus on access, as I know many of you on the call are probably doing, trying to address the challenge sometimes for people to get to the resources that we need. We've begun to offer the telemedicine for psychological and psychiatric appointments as well, and I've seen a really positive uptake in that. We've been offering an EAP program for our employees, especially here in the U.S., for well over 40 years. We've expanded that globally so our employees and their families are able to participate in our EAP program and other work-life services. One of the things that we offered the past 18 months is a backup dependent care program, and this is really to help our employees better manage their many work, family, and personal responsibilities that sometimes when those converge, employees find a tough time, finding the balance that they need, and it contributes additional stress in their life. And this is a high-quality, low copay backup care for both children and if an employee has an elder or an adult that they're taking care of. It gives you a backup family care arrangement when your regular programs fall through, and this really has been positive for our employees to manage some of the many stressors of today's workforce. The other area that we've been focusing on is meditation and mindfulness, as I'm sure, again, many of you are as well. We look at a wide range of techniques to reach our employees using telephonic, we do in-person, we've done digital, and most recently we had the Be-Time meditation bus on campus for employees to go in and actually practice a meditation there. Chris, next slide. We do offer to our J&J employees a program called Energy for Performance, and I wanted to just share that briefly with this group because we've had a commitment to train over 100,000 employees in the principle of energy management, and this really allows our employees to not only focus on a multidimensional approach that includes being spiritually nourished, physically focused, and finding purpose in life, but it gives an aspect of managing energy and resiliency and being better prepared when the tough things in life are coming your way. We've evaluated this program looking at a cohort group of about 26,000 employees, and we found that we've seen improved retention of our employees, improved performance, and improved engagement. And while you can see on this slide, we found other things like people that have participated are likely to have a higher performance rating. They've been more likely to be promoted. We found that this is a great alignment with work-life balance, that J&J supports our employees achieving a healthy healthy lifestyle, and saying that J&J is a great place to work. Next slide, Chris. The other thing that we found to be really important with our approach to mental health is making connections and helping our employees feel connected. You know, when you look at the size of our organization with 130,000 employees at 260 operating companies around the world, building connection is really important to building engagement and building psychological well-being and connection back to the business. And we've used digital tools such as Healthy and Me to make that happen. We've had a global activity challenge, blending the opportunity to be physically active, having our employees come together. We had more than 33,000 employees increase their movement by 39% in a 21-day challenge. And this brought our employees together to be part of something bigger, because the cause that they were working together for was to be with each other, contribute towards charity, and it helped reduce loneliness and have a positive impact on overall well-being. I'd like to highlight three quick things, though, as I'm wrapping up here, and that is we have a very strong employee resource group within Johnson & Johnson. It's our mental health diplomats. It's part of our group for Alliance for Diverse Abilities. This mental health diplomat group started in 2017, and we currently have about 1,000, almost 1,200 of our employees in this employee resource group, focused on reducing the stigma around mental health, helping talent development in this area, focusing on philanthropy and bringing customer insights forward. And we focus on areas such as depression, anxiety, substance abuse and addiction, bipolar, eating disorders, and really care for the caregiver as well. And so I would tell you with this upcoming World Mental Health Day, we anticipate that more than 100 of our J&J locations will be involved in events globally and really raising the awareness of mental health through the use of our employee resource groups. We have another group called Gen Now, which we're really able to connect into our millennials to really understand the challenges of that group in the workplace and to help us build a very inclusive work environment where, again, where everybody can be their best. And the last thing I would say about making connections is the power of storytelling. We have our own TEDx in J&J, and we do many YouTube videos where our employees are telling their own stories. We have leaders sharing. We use internal and external social media as well, so that when somebody feels comfortable sharing their story, it's very, very likely that somebody else will tell their story and not feel so alone. Next slide, Chris. I did want to just share a resource that anybody on the phone can also access. Our Janssen Neuroscience business is a founding sponsor of a content library that's been put together through PsychHub. Founded through Patrick J. Kennedy and Marjorie Morrison, PsychHub's mission is to share mental health education around the world. And there's a great range of free online resources that are short, clinically relevant, and really engaging videos on mental health. So please feel free to access and use those for your employees. Next slide, Chris. So really, if I sum it up, I think together we can, not only here at Johnson & Johnson, but all of us together on the phone, we really can reduce the stigma to enable employees and family members to start their mental health journeys, watch engaging, uplifting videos, turn and have a conversation with other people. We can scale and optimize mental health education, not only for individuals, but really working with healthcare providers as well, providing great resources. And our goal then is to cut through the noise so that we can all reach people in need where they are with a wide range of devices, tools, tablets, and messages so that we can help reduce this burden of pain related to mental illness and also the economic cost as well. Chris, let me turn it back to you now.
Great. Thank you very much, Jennifer. It's really wonderful to hear you share the impressive initiatives that you can offer to your employees. Before we carry on with our next employer case study, let's pause and hear from our audience again. This poll question is, what is your company doing to help employees get support for mental health issues? A, do you have mental health education and resources? B, manager mental health training? Jennifer mentioned that. Digital tools and programs. Do you offer an EAP? Do you have a culture that is of mental health, positive mental health that is supported by strong leadership? All of the above? Maybe none of the above? So it's going to be interesting to see where we land here. Jennifer, can you say something briefly about what you might think of what has been maybe one of the barriers that you've encountered in doing this work at Johnson & Johnson?
You know, I would tell you the barrier is both the strength, and that is helping people feel comfortable that you can share mental health at work. I think, Darcy started off that people are often afraid to bring it up or to talk about it, not only because of the stigma, but concern about the security of their role or the way people might think about them. I think that really has been the biggest challenge more than anything is getting people to talk about it. But that sharing starts a cascade because inevitably when one person shares, somebody else shares another story and somebody does as well, and you start building a culture where people feel that it's safe to bring their true self to work and share the personal experiences that they have. They don't feel so alone.
Great, thank you. Well, the results from the poll are fascinating. So the majority of people answered yes to an employee assistance program. 93 out of 213 people. I'm not sure what that is in as percentage. My mental math is not so good. But also very interestingly, 10% of companies say they do all of the above. And so we seem to have a group of overachievers in that top 10%. And then about 2% of respondents said that they currently don't offer any of these resources. So thank you for participating in that poll. A strong vote of confidence for EAP. So I'd like to move on to our final speaker, Janelle from OrthoCarolina. Over to you, Janelle. Tell us more about, OrthoCarolina. I don't think employs 130,000 people like Johnson & Johnson. I'd say you're probably a medium-sized company, but tell us a little bit more about your company and what you and your role as the Wellness Program Manager have managed to do with the resources at your disposal.
Yes, thank you so much, Chris, for having me on today. I'm really excited to talk about our approach to mental health and what we're doing at OrthoCarolina. So OrthoCarolina is one of the nation's leading orthopedic practices, bringing expertise in the areas of foot and ankle, hip and knee, shoulder and elbow, sports medicine, and pediatrics, including orthopedic surgery and physical therapy. And like J&J, our goal is to reduce that stigma around mental health. We do promote healthy bodies, in a large part of our program. And so that's things through fitness classes, educational seminars about nutrition, so on. So our goal really is to incorporate programs that promote healthy minds as well. And just wanted to provide a snapshot into what a mid-sized employer is doing for mental health solutions. So we have organizational challenges every year, and those range from anything to tracking steps to tracking exercise, but really focusing on mental health. We do 2 challenges every year specific to mental health and well-being, one being morning meditation. So we challenge all of our employees to start their day in a healthy way by meditating for at least 10 minutes each morning. So folks can go in and track these minutes meditating every day. The goal is to get 1 month of meditation. The second challenge we like to incorporate is the Sleep Well Challenge. In this challenge, employees strive to sleep at least 8 hours every night because we know there is such a strong correlation with sleep and mental health. Those that aren't sleeping at least 8 hours struggle with things like focus and productivity at their jobs, and it really starts to just spiral downwards if people aren't getting good quality sleep. So we do challenge our folks to do that, again, for 4 weeks, and these are incentivized challenges. So if folks are completing these, they are awarded and incentivized through our wellness program. These challenges are open to every employee, so regardless of if they're PRN, part-time, or full-time, they can participate in these challenges, which is great for morale. Next slide, please, Chris. As most of our attendees are doing, we heavily rely on our EAP, Employee Assistance Program, to kind of help us combat mental health in our workplace. We all know that this is a no-cost, confidential program that allows access to a licensed professional, and our program actually provides up to 6 counseling sessions per person per year, which is a very generous program. There is unlimited telephonic support provided. There is also legal advice, financial resources, so things like resources for budgeting, debt, bankruptcy, estate and retirement, investing, and taxes. So we do really rely heavily on our EAP program. We have seen a 27% increase in utilization through our EAP from 2017 to 2018. So we know that our population is using the EAP, and we want to continue to really just make sure that this is a utilized program and that people feel comfortable using it. So like Jennifer said, a lot of people feel that their privacy may be at risk, or things like that. They don't feel comfortable using the EAP. So really just educating our staff on the benefits of the EAP and that it really can be a helpful tool for them. Next slide, please. So look into 2020 solutions. For next year, we do want to bring on-site meditation to our location. So our biggest one is our headquarters. We have over 200 employees at this location, and so we are going to be partnering with a Charlotte-based fitness and wellness vendor to offer 30-minute customizable guided meditation sessions, and these are led by a certified meditation ambassador. We know as a whole meditation and the mindfulness that results from practicing it can have significant benefits on cognitive control, stress management, and overall happiness. And with the implementation of guided meditation, we hope to see increases in focus, resilience, happiness, hopefully job satisfaction, compassion, and of course, increases in better sleep. So this is something that we're excited to implement next year and hope to roll this out into some of our other locations. We do have 40 locations across the U.S., so our employees are spread out over North and South Carolina in a clinical setting. So this will be a challenge, but we do hope to get this in every location. Next slide, please. Another solution that some of you might be familiar with is Headspace. So Headspace is a mindfulness training and sleep program and the source of an application. So we are looking to implement a 30-day pilot program with Headspace in North Carolina. This will give employees access to the Headspace mobile app for free, which has over 1,000 hours of guided mindfulness meditation courses, sleep exercises, and eyes open exercises. So what's great about the Headspace program is that there are 3 different programs that you can choose from. So there are mini sessions ranging from 1 to 3 minutes. There are single sessions ranging from 5 to 10 minutes, and then longer courses that range from 10 to 30 minutes, which is great for the worker who may not have that long of a lunch break or just has 5 minutes and they'd really love to kind of take a time out and maybe throw on a guided meditation about stress. So just wanted to provide a little bit of information about a case study through Headspace. Through a Headspace case study, after 30 days of using the app, 536 participants from 7 corporate clients reported that they felt less stressed or anxious. They were more compassionate or patient with others. They were more present throughout the day, and they felt it easier to fall asleep. I think these are a wonderful case study that kind of shows us how helpful guided meditation can be in the workplace. So we're excited to bring this to our employees in 2020. Next slide, please. And then lastly, mental health first aid. So this is something brought to us by our health plan provider. So this is an 8-hour course teaching adults how to help someone experience a mental health addiction or challenge or in crisis. So this is an 8-hour training, and our goal is to have every manager and leader attend this training to better identify and respond to someone having a crisis or a need. So some things that are covered in this course are common signs and symptoms of mental illness, common signs and symptoms of substance abuse, how to interact with a person in crisis, and how to connect a person with help. So I think this course can really be a provided benefit to our managers and leaders to really just help educate how to help someone. So this isn't knowledge that comes naturally to us. You know, a lot of mental health diseases can really not show very clearly if you were just talking to someone. So really identifying, you know, how to help someone and, you know, how to help them and provide them the resources that they may need. So So overall, these are our 2019 and 2020 solutions that we are excited to bring to OrthoCarolina this and next year. And with that, I will turn it back over to you, Chris. Thank you so much.
Thanks, Janelle. It's really great to see what programs and resources you can offer your employees, ranging from, those in-person meditation sessions or mental health first aid to providing people with an app like Headspace, because, I think that employers probably want to reach employees wherever they can access them. And that's the topic of the next poll that we have. So, folks, you've got about 30 seconds to tell us what do your mental health offerings include, and do they include any of the following technology-assisted components: telephone counseling, app-based programs, digital mindfulness training, resilience training. Perhaps you have something else in place, or perhaps none of the above. And so, Janelle, I asked Jennifer what, one of her barriers or opportunities, barriers and or challenge opportunity is in doing this kind of work. What has been your experience at OrthoCarolina? Is there any specific barrier and or opportunity that stands out for you?
The biggest barrier, I think, very similar to Jennifer with Johnson & Johnson employees, is just really helping to make those employees feel comfortable talking about mental health. There is such a wall up, and just breaking down those walls and helping people realize that coming to work is a safe place, and we're here to support those folks, providing the education and resources that they need. So yeah, I think, just making those employees feel comfortable that if they are struggling with something, they can feel comfortable enough to know that their employer is here to help them.
Great, thank you. So I'm just looking at the results of the poll, and there seems to be sort of equal offering amongst app-based programs, digital mindfulness training, and resilience training. 10 to 13% of those on the phone calls on this webinar say that those are approaches that they adopt, and the clear winner in these modalities is telephone counseling. So it looks like telephone counseling is still popular, and that makes a lot of sense. So thank you to Darcy and Jennifer and Janelle for sharing with us their programs and their approaches. In the last few minutes that we have available, I wanted to share some things with you from an AHA perspective. Earlier this year, we conducted a poll with Harris Poll on mental health in the U.S. workforce, and I'm not going to read all of the statistics on the slide, but some that stood out for us is that 3 out of 4, 76% of people who were polled, who were respondents, said they had struggled with at least one issue that affected their mental health. And of those people who had a diagnosis for a mental health disorder, 63% of those employees said that they would not feel entirely comfortable disclosing that to their supervisor. So we see a signal here around concern or stigma in the workplace, and I know our other speakers have spoken about it. And 9 out of 10, an overwhelming majority of those people who were polled, said that they feel that employers have a responsibility to support their employees' mental health. And 40% said that manager training was a good idea. So it's good to know that some organizations are offering manager training like OrthoCarolina using mental health first aid. So Jennifer mentioned the 7 high-level strategies. These come from a white paper that the Center for Workplace Health published earlier this year, and you can find it on the web if you Google AHA mental health or workforce crisis. And again, I'm not going to read this slide, but just draw out the main components of it. So what we recommend at AHA, and these recommendations were informed by an expert panel review, and Darcy participated at that. Our main recommendation is that companies have a written mental health policy and a mental health action plan. So to create that policy, to make sure that that policy is integrated into safety, into the organization's safety, wellness and well-being policy, to make sure that the organization offers a comprehensive set of services and benefits to employees, and to communicate often about these employees. What we've heard is that often organizations have mental health benefits that employees are not that aware of. So communicate often about what you have available to your employees. This is a very busy slide. I'm going to leave it on so that you can read it. We will be circulating a copy of the webinar, and this is something that you might want to use as a reference or a resource. What this shows across the horizontal axis is the spectrum of risk that you have in your employee population and the various levels of prevention. And then on the vertical axis, there's information about how you might think about approaching this population. What are some of the core internal programs that are part of that approach? So, for example, ranging from mainly online tools and mental health promotion for your healthy folks to, on the other side of the spectrum, making sure that you have EAP, telemedicine, mental health primary care, and also integrated disability management for your population that's at very high risk. And then across the bottom, some foundational strategies. I think the main one there is making sure that your organization builds a supportive culture that is perhaps you can think of as being kind and health focused, and also ensuring that there's psychological safety at work. So I'd like to end off with our poll question. So what is the most challenging barrier to supporting mental health in the workforce from your perspective? You've heard from our speakers here. We'd love to hear from you. Is it lack of support from leadership? Is it lack of resources? Is it stigma? Is it lack of employee engagement? Or perhaps it's all of the above, and if you're exceptionally lucky, maybe you don't have any barriers. And while we're waiting for that poll question, let's just see if we've had any other questions from the audience. Okay. So one question that came through is, how can we close the generation gap when it comes to attitudes about mental health? Darcy, can I hand that one over to you? Do you have any thoughts about that?
Yes, you can definitely hand it over to me, because the APA in May released a national poll that showed that a question was asked about the willingness to discuss mental health in the workplace. And what it showed is that the younger generation is more willing to discuss mental health in the workplace. They seem to know more about it. But the catch is, in that same poll, what it found is that they were also concerned, at least a third of them, that doing so could potentially have negative consequences. So again, younger, and what was interesting in the poll, and it's actually on the American Psychiatric Association's website, is as you got older in age, the likelihood of being comfortable talking about mental health in the workplace went down. And so I think that's good news in the sense that the younger generation is more comfortable talking about it. But the issue is they are concerned about negative consequences of doing so. So we all have a responsibility to help people feel like it's safe to come forward and get help when they need it in the workplace. And it's not that you have to discuss your mental health issue with your employer, because it's privacy just like any health issue. But it's really a matter of employers can really play a role in reinforcing that when people have mental health conditions, they should get help for it, because early help, like for any health condition, leads to the best results. So the bottom line is younger employees, more willing to talk about it, just have concerns about negative consequences.
Great, thank you. I think that's a nice segue to the results from our poll. Very few people feel that a lack of leadership support is a barrier, which is terrific. And almost equal percentages, around sort of 10 to 15%, feel that lack of resources, stigma, and lack of employee engagement are issues in the workplace. So I'm sorry, our time is up. This hour has gone by very quickly. I'm very grateful to our speakers who joined us today. Thank you, Jennifer, Janelle, and Darcy for your participation. And I also want to thank the AHA staff who made this webinar possible. I hope that it's been interesting to you, that that this information has been helpful, and a recording of this webinar will be distributed. So thank you very much for your participation, and we're signing off from Dallas here at AHA. Thank you.
Thanks, Chris. Bye.
Bye.